I estimate in the United States alone, there's probably 50 to 100 million people who would benefit from testosterone, but do not take it because it's stigmatized. We can extrapolate that to 1 billion people worldwide.
I also think it's a lack of understanding that hormones are front and center in human biology. And if we're dealing with all of these lifestyle factors, environmental factors, dietary factors that are negatively affecting our hormone production, it makes sense that this field is something that people are going to kind of need sooner or later if they want to optimize their health, longevity, and performance.
This has been a long time coming. We're here with Dave Lee. Dave, I have been a fan for a long time. I have watched you even before I started my clinic. I've really appreciated your content. It was kind of funny. Similar to you, I always hear people, telling me about Dave Lee and how I should talk to him sometime. And I had been thinking about doing it prior to that anyway. So this has been a long time coming, and I think it's going to be great. One of the first things I think it's prudent to converse about, especially coming from different parts of the world. So we have two different interesting perspectives. The almost global stigmatization and demonization of testosterone, TRT, hormone replacement therapy. And it seems to be similar. I talk a decent amount with people from outside of the United States, and it's very similar in the inadequately addressing hormone deficiency. And hormone deficiency is pervasive, and it's just not well understood. So I guess one of the first things I would like to begin to discuss is, what are your views on some of the reasons? We kind of both understand that it's not just one thing that causes this universal stigmatization. It's a myriad of things that kind of coalesce and create this big problem. If it was one thing, we could easily just fix it, right? Like we could just say, okay, here's the problem. Let's re-educate and fix this. And then all of a sudden people would be using testosterone as much as they really should be. But there tends to be a myriad of different things that coalesce and create this massive problem that's hard to nail down, hard to pin, and hard to fix. Let's start there. What do you think are some of the innate, inherent reasons for the demonization, the stigmatization?
Yeah, as you said, I think there's a lot of things, and I don't know which one, is the dominant thing and which one is the supplementary thing. But one thing that I know for a fact that is part of it, at least in Australia, is that because testosterone is classified as a performance enhancing drug, technically, in terms of how they classify it, at least, same with DHEA, which is why DHEA is prescription only in Australia as well. It's scheduled alongside the other anabolic steroids, not alongside the other sex hormones. So I think that the way that it's scheduled in terms of it's deemed a drug of abuse, it's more difficult to have prescribed. A lot of doctors are afraid of it being prescribed because they think that they're going to lose their medical license if they give a private prescription for testosterone because it's not going through an endocrinologist. And I think that's part of it. In terms of going a little bit down the conspiracy rabbit hole straight off the bat, I dropped out of neuropsychiatry when I was at university because I was going into the course thinking I was going to learn how to heal the brain and learn why so many people were experiencing these kind of low-grade mental health disorders, across the board. I quickly learned that that's not what you learn in that degree. You just learn how to drug people. But I also think that an important component of this, and I think it's a significant one, is that the pharmaceutical industry is very heavily involved in how medications are prescribed. I mean, when you do a medical degree, a lot of it is learning to prescribe medicine, which in the Western paradigm is pharmaceuticals. And because testosterone has been off patent for so long, and I mean, you can put a new ester on it and, give it a fresh coat of paint, but it's very difficult to make money on bioidentical hormone replacement therapy. And I think that trickles into a lot of things in terms of the doctors a lot of the time will push female birth control instead of bioidentical progesterone for a progesterone deficiency. So it trickles into women as well. But you can go as far back as looking at the early prescribing guidelines for pregnenolone before corticosteroids were developed. And then corticosteroids very quickly replaced pregnenolone in the prescribing guidelines because lo and behold, in a clinical trial, they were more efficacious for what they were treating, but they also had a myriad more side effects. But that's not the problem. So I think patenting medications is a factor. And I think that the pharmaceutical industry's influence in the way that the medical paradigm is structured and operated and continues to evolve kind of shoots bioidentical hormone replacement therapy in the foot because a less profitable medical intervention is always by default going to be alternative under that model. So I think those are two big factors, the performance enhancing side as well as the pharmaceutical industry. But I also think there's just a lot of misunderstanding around the body being a series of interconnected systems, which is something I've been speaking about for a long time. And the reason that I got into hormones, I mean, I wasn't into like a health and fitness and sports background. I was coming from a mental health background.
Mhm.
And I gravitated towards testosterone because I was like, well, hormones are the kind of marionette puppet masters that run the show for everything. So
Mhm.
if the body is sick, I mean, I had a brain injury that no one could diagnose and no one could tell me how to heal. And my idea was, well, if I can set the body up to heal itself and then put the right nutrients and the right stimulus in, then maybe I can recover. And
Mhm.
I very quickly worked out that you had to have an optimal hormone environment to do that. So I also think it's a lack of understanding that hormones are front and center in human biology. And if we're dealing with all of these lifestyle factors, environmental factors, dietary factors that are negatively affecting our hormone production, it makes sense that this field is something that people are going to kind of need sooner or later if they want to optimize their health, longevity, and performance.
Yeah, that was very well said, very articulate, and pretty much spot on what I see. Like, so, getting to the root of what you're saying and everything you said is I absolutely concur with that. The fundamental foundational problem with educating providers about hormones, right? And you're right. So when we look at the United States, and it probably works similarly to this, and around medical schools, the pharmaceutical companies do fund medical schools. They have a say in the curriculum, and they're going to teach towards the medications that make them the money, right? And as you indicated, testosterone, the patent's up. It's been around for 80 years. It doesn't generate a lot of revenue because it can be compounded. It's kind of easily made. Also, continuing medical education for providers. The pharmaceutical companies run continuing medical education, and again, they're going to teach around the medications that are going to make them the most money. I mean, this is just kind of factual, right? But like if we want to start talking about some of the conspiracy, like, is there intentional suppression of testosterone because there is more money made treating the fallout from low testosterone than there is actually treating the root of the problem and getting people's testosterone? I don't have any direct evidence. I've looked. I don't have any direct evidence of intentional suppression. A lot of people, a lot of conspiracy theorists would say, yeah, of course they're doing that. And so another reason, and you're right, a lot of it has to do with sports, as ridiculous as it is. The idea that in the United States, it was Biden specifically said, well, I don't know what's going to happen with baseball games. Are people going to show up? So it was kind of like, it was like a lot of, and then Ben Johnson in the Olympics, tested positive for Winstrol. So it had a lot to do with sports. They wanted to maintain this integrity in sports. So therefore, we're going to suppress this massively beneficial treatment protocol just because we want people to show up to baseball games, right? So in this period, though, when the stigmatization was starting, we have like worldwide organizations like WADA that are making sure that there's integrity in sports, but also demonizing them at the same time. And there seem to be some really poorly run studies, a series of them, starting from the beginning of the stigmatization, which I would say is the late 80s, early 90s. In the United States, testosterone became a controlled substance in the 1990 Steroid Control Act. So around that time, there was a lot of studies that came out that showed all the massive benefits of testosterone and other derivatives of testosterone. And then from the late 80s to about 2016-ish is when I see like the last really poorly, really biased study. And there was a lot of studies that came out that were just incredibly biased and that found some of the classic side effects that we now know are not accurate, that are not correct. Studies that showed testosterone can cause cardiac issues, right? We now know that's not true. At the time, that there was about four studies showing that testosterone may cause cardiac issues. There was over 100 studies that showed not only did it not cause cardiac issues, but a lot of the studies found that it was actually cardioprotective, which we now know, right? And that book is closed on that. Like we have closed that chapter. Testosterone does not cause cardiac issues. However, why did the FDA in our country decide to promulgate the 4 studies and put a black box warning on testosterone kind of due to these 4 studies instead of listening to the other 100 that showed something different? And those studies were poorly run and now are widely discredited, and the original authors have done retractions. So one of the cardiac studies was as simple as they had a math error. Now, as a scientist, how do you publish a study with a math error? And why would it be so? Why would these studies be so incredibly biased? Like, it almost seems like for a professional scientist to publish something so quickly as to have a math error in it. When we redid the math, by the way, we found that it showed the opposite, that testosterone actually was cardioprotective and not caused adverse cardio events. But why would these incredibly biased studies come out all in the same era, right when testosterone was being so demonized? Like, it almost seems like there was incentivization to write these studies in a biased manner that showed this. We don't have any proof, but it's hard not to believe. So also, testosterone causes prostate cancer. We now know that's not true. Testosterone increases the risk of blood clotting, clotting disorders. And we now know that that's not true. In fact, I found a study that shows that testosterone actually reduces procoagulation and reduces thrombin, produces antithrombin, and actually fibrinolysis, which reduces existing clots. I think a lot of these studies had a lot to do with it too. You can still see it. Like, whenever the media was a big problem too. When the black box warning was put on testosterone, the media would just get a hold of these and promulgate all of this stigmatized information that we now know to be exactly the opposite. So the media had a problem too, and you can still see it. We just watched a video where they asked about the huge increase in use of testosterone, and of course you have a cardiologist on there he's older and he's going by the antiquated notions and dogma from decades ago, and he's saying, oh yeah, testosterone causes all these problems, and it's just not true. So part of the problem is the media asking the wrong people. Like, you're asking a cardiologist. One thing we know about, if you go to medical school, you do not learn about these hormones. So you're asking the wrong people who don't actually learn about these things, and they learn the little information they do learn is the antiquated notions and dogma from decades ago, the wrong information. All of this kind of combines and creates this massive stigma, massive demonization, and inadequately addressing hormone deficiency.
Yeah, absolutely. And the couple of things I'll add on that, which one thing that's been very interesting for me living over here in Lithuania, and for those who don't know where Lithuania is, it's a very normal reaction to have. I didn't know where it was either. It's technically Northern Europe. A lot of people think of it as Eastern Europe, but it's one of the three Baltic states north of Poland. So up until 91, Lithuania was part of the Soviet Union. And as a result of that, we have this kind of interesting amalgamation of Western medicine and Soviet medicine. And I find Soviet medicine very interesting because Soviet medicine is actually built a lot around peptides. I mean, they're the ones who came out with the bioregulated peptides. People often hear about things like Cmax, C-Lank, cerebrolysine. They're stocked at the local pharmacy in my town. So these compounds are actually part of our medical system. And the interesting thing with the medical system over here, and all medical systems are flawed, but the thing that I found over here is that they're very focused on root cause and they're very focused on recovery. So recently I've been dealing with a sciatica issue, and I've been researching alpha lipoic acid infusions because they've been shown to be beneficial for nerve regeneration for diabetic neuropathy. And those studies were actually done over here in Eastern Europe. And lo and behold, you go down to a local general practitioner and they go, yeah, we'll give you 10 infusions of ALA, come in every 3 days and we'll do 10 infusions and it's covered by your insurance, nothing to pay. And this was very interesting for me because when you'd speak to the doctor, the sessions would be a lot longer. They'd come out with a big plan for you. Everything would be subsidized that you actually needed. But I was sent off with like high dose B1. I was sent off with a bunch of nutrient therapies as well. And they still have the Western pharmaceuticals as part of their toolbox, but they seem to be very much orientated around fixing people to help you get healthy and strong so that you don't burden the healthcare system. Whereas without going too far down the conspiracy rabbit hole, I do kind of wonder two things. I do wonder if the Western medical model is based on this idea of keeping people sick enough just to pay their taxes, but not healthy enough that they'll push back against the system. And I also wonder, with all the technology we have in 2025, would we still be able to be governed if every man was walking around with high testosterone? Like, I really kind of ask and go, like, I think that would lead to a problem. And I think that there has to be some kind of awareness of that. I mean, one thing that's very interesting when you do neuropsychiatry is you learn about this thing called operant conditioning, which is basically like training to follow rules. And they find that everything from SSRIs to antipsychotics to even, dexamphetamine or amphetamine derivatives, methylphenidate, Ritalin, all increase operant conditioning, whereas one of the only molecules that reduces operant conditioning is testosterone, which
No kidding.
makes sense to me. Yeah.
That is
So
fascinating.
when you look at something like that and you go, man, if I was running the world, I probably wouldn't want everyone on this. This would be a bit of a problem. But it's definitely interesting when you look into it, because I remember when I was first looking at all of the kind of brain mechanisms of action of testosterone and kind of comparing it to the mechanism of action of things like off-label antidepressants, like over in the US, things like Wellbutrin, bupropion is quite common. In Australia, we only use it for ceasing smoking. But I was kind of comparing it to all these different psychoactive compounds, but particularly compounds that worked on dopamine. And when I was looking at how testosterone worked, how thyroid worked, how DHEA, pregnenolone worked, I was going, hang on, this is the kind of perfect mechanism of action if it came to being like, what would be the dream designer psychiatric medication that we could create for people? I was like, it would be if all of these hormones were optimal in the brain, and then the brain would just function the way that it should.
Mm-hmm.
And it's, to me, it's very interesting that the model that we seem to be defaulted to in the West is creating patients for life. And I know that testosterone replacement therapy is also an ongoing treatment, so there's a bit of irony to that.
Mm-hmm.
But I always found it very interesting when you are studying psychiatry that there's this very strong preference towards the new medications that are under patent, because for people who don't know, who are listening, when a pharmaceutical company develops a new drug, you get an 8-year period that you basically have the patent for it. So other companies can't make a generic for it, which is why up until the recent years, tadalafil Cialis was like insanely expensive, and then it got very cheap and available. The patent expired. And this is, the idea of this is that it's to recoup your research and development costs, aka make an absolute killing. And pharmaceutical industries are profitable businesses, and they're private businesses run to make a profit, so that makes sense. But I found it very interesting that in psychiatry, the newest drug that was under patent also just happened to be the best drug that we had. And I'd be sitting there going, well, hang on, this medication sounds quite novel, but because it's new, we don't have any long-term studies on it. So why are we preferring these novel medications that are under patent over these older medications that are tried and true, that work well, that are cheap and available and generic? And they basically go, shush, maybe you should drop out of this degree, stop asking questions. So it's look, it's interesting, and the problem that you're alluding to, which is really important, and people in America think it's bad. I mean, over here in Eastern Europe, I mean, the stigma is 100 times worse. But it's the problem is that people are either stigmatized in terms of they feel like they're cheating, or they'll be judged, or there's something wrong with them if they need hormone replacement therapy. But then also, if they get over that barrier, they're then shit scared that if they take the actual optimal amount of testosterone, which is one thing that I know that we agree on, because I've seen your take on it, which is very important, which is that a lot of the time people are going, oh yeah, I need TRT, but I don't want to take too much because then I'll have a heart attack, get prostate cancer, and die, which that's going to happen from hypogonadism, not having optimal androgen levels. But people are either afraid of going on it out of principle, or they're afraid of what it's going to do to them if they actually correct their hormone deficiency. And I think that fear and anxiety and stigma is leading, I would hate to think the number, thousands, tens of thousands, hundreds of thousands, I don't even know, but so many men who need this treatment who aren't seeking it due to being misinformed.
I couldn't agree with you more. And I think the number is significantly north of that. So you and I both we can walk around in public and we can point out hormone deficiency. Like I can see it just by the way people form, just by the way they're walking or act, So like I estimate in the United States alone, there's probably 50 to 100 million people who would benefit from testosterone, but do not take it because it's stigmatized. We can extrapolate that to 1 billion people worldwide.